Thank you so much. Welcome, everybody. Hopefully, everybody can see my screen well. And I'm super excited and thankful for this wonderful opportunity. The topic that I'll be presenting or talking about is titled Embracing Digital into Mainstream Healthcare, Thriving Post-COVID-19. Maybe this is wishful thinking that, inshallah, I hope we will be getting rid of this pandemic and the stress that it has been causing all of us soon. So trying to look outwards and into the future, inshallah. But really, before I start, I just wanted to maintain or share with you some disclosures. I have nothing to declare that could be perceived as a conflict of interest. All the views that I will be expressing in this presentation are really mine. They do not represent anybody that I work for or work with. Unless otherwise stated, all the images have been borrowed from Google. So they maintain, and the original contributors maintain their copyrights. So overall, I'd like to cover some background information. We're going to be talking about the opportunities for digital. What are some of the challenges that are associated with digital? We're going to be obviously also, and very importantly, very close to my heart, talking about some ethical considerations when it comes to leveraging digital tools and technologies, especially in healthcare. And then finally, we'll conclude with some recommendations and hopefully allow some time for some of your key questions that would be popping up. And I encourage everybody, if you have any question, there is a Q&A button at the bottom right. Please feel free to type in your questions, and I'm sure my colleagues at the organizing this conference would be able to share these questions with me at the end of the presentation. So it goes without saying, but I think everybody, unfortunately, is feeling the toll of COVID-19, right? Especially when it comes to health. We're all seeing what's happening with the economy, with education, and how education really has been impacted, especially here in Kuwait. And I speak as an educator, and it's been a sad reality. We've all seen how COVID has impacted transportation, whether that's air, sea, or even on land, and how some of the curfews and lockdowns are causing in terms of traffic jams, because we all go out at the same time and return homes at the same times. What's happening in the workplaces, what's happening in our homes, and many facets, that are impacted by, this tiny virus that, we cannot see with our own eyes. So it's been pretty exacerbating, but I think, as human beings, we're pretty resilient, and I'm very appreciative of that. Now, when it comes to opportunities, for digital, maybe we're super excited, about some of the key digital interventions that we can employ or deploy. And this conference has been all about digital, especially in the public space or the governmental sector. But let's think about some of the digital interventions. They could be serving as what we like to call ePPE, or electronic personal protective equipment. And this can go both ways, right? So it can go both for the clinicians or the healthcare providers or the workers in healthcare institutions, admin people, the staff that clean or, transport a certain material, the nurses, the physicians, the lab technicians, so on and so forth. This can help protect them, but also can help protect, the consumers or the patients, as well as, their caregivers or their family members. So, when we think about, using, telemedicine, which I think has been a highlight of many of the talks, in this conference, this could be a wonderful and fantastic ePPE, right? So we can provide some advice, we can see some of the patients and, follow them up, but also at the same time, protect both the consumers as well as the clinicians. And also with telemedicine, thinking about it, in a different way, we can potentially provide real-time access to care, right? We can be overcoming issues of geography, transportation, and we're seeing even, a reduced load on ER and emergency departments. And the reason for this is if we're using some of these technologies and tools as triaging tools, right, and trying to determine the priority using, technologies such as artificial intelligence and chatbots, where we can filter and get to the patients or the persons that need the care the most, I think this is a fantastic and super exciting intervention overall. When we're looking at technology, and this is the promise, as informaticians or as experts in the field, we're arguing that it reduces the overall costs, and also it can improve workflows and potentially even diagnosis, right? And here we're not necessarily calling for replacing human beings, especially in healthcare. So, and maybe this is a plea to my technical colleagues. Digital interventions cannot replace human emotions, especially in healthcare. But what I can tell you, digital interventions or clinicians or professionals that use digital interventions will be replacing those that do not use digital interventions. We're upcoming with, the generation Zs of the world, the generation Ys that, all they know is digital. So, this is, something to come, and many, many more, if you will, opportunities to leverage. So really, what is it about these digital interventions that would be enabling us? So if we can collect and use data as a key strategic intervention, right, especially in the government sector, I think, we would be succeeding, beautifully. We all know that the new oil, and we're an oil producing country, right? The new oil is data. And we know, especially in the private sector, our private sector partners have been doing a fantastic and amazing job in terms of leveraging data for, gaining insights into their workflows, into their operations, into their products, right? But usually the public sector usually lags behind. And this is what we want to push forward and encourage, especially, this conference. It's titled the e-government. So we're calling and pushing forward on our colleagues to really embrace, data and data insights, not only for running their daily operations, but actually gaining insights and making informed, evidence-based decisions. Right. So, I put some examples here of where this data could be coming from, whether it's telephone towers, mobile phones, Bluetooth connections, surveillance videos, right? And there's a plethora of sources that we could be using. Now, with that, our digital landscape, especially, and this is an area that I've been actively working in, and we're missing a lot when we're not engaging the consumers of healthcare services, or in other words, maybe patients. I don't, in the community, we don't like to call everybody a patient because they may not be a patient, but they're definitely consumers of our healthcare services, right? Now, with the affordability and the ubiquity of the internet and the many, many apps that are out there, I think we have an opportunity to leverage, some of these apps or some of these interventions as the digital therapeutics. So imagine you going to your appointment with your physician, and what they prescribe to you is not necessarily a medication, but they could be subscribing to you an app to download. We all know Kuwait ranks as one of the among the top nations in mobile subscription penetration, as well as internet in the Arab world, right? So there have been some estimates that, more than 90% actually are on the internet. And I think one of the studies or one of the reports was saying in Kuwait in particular, people have 2 or 2.5 mobile phone subscriptions, right? So we do have an opportunity that we, could be leveraging for this. Now, with apps specifically, there is an increased convenience of travel, right? Because it can save time, anonymity if we do it right. And now there are some examples that have not been doing it right. And this is something that we're going to address in a little bit, but, it can provide anonymity. So there are many examples of some apps, especially for mental health and the stigma, unfortunately, surrounding mental health. And really the COVID pandemic has shown that, very clearly. But, there's many programs where we can get help and support, mental therapies or mental health therapies, being anonymous, using, these apps in a certain way. But overall, we could be reducing the expenses, both on the consumers as well as, the healthcare system. But, in a sense, well, Dari, this is great. You're the expert in this, or one of the experts. So why should we care, right? So the pandemic really forced us to leverage digital health tools, systems, and technologies, whether we liked it or not. And this is something, that, I think for me, it's been super, super grateful because, we're technologists and we appreciate this move. We've seen an explosion of telemedicine, working remotely. This conference is an example, right? Although I hope, soon, maybe the next version of this conference, we hope to meet you all and see you all in person, inshallah. But, in Kuwait, we have a small nation with a centralized healthcare service. We're a young population, so 70% of Kuwait's population are youth, with high smartphone penetration. We have high literacy and e-health literacy rates, and we've confirmed this with studies and evidence that we did and carried out here at the university. We're economically advantaged as a nation. And I say this at least for now. May Allah help us all, throughout this. But, again, there is an opportunity to seize, but we also need to be considering and appreciating that healthcare is a complex ecosystem. It is not an easy ecosystem. There are many workflows and interactions that happen, many things that are interconnected, and there are many legal requirements that can vary by jurisdiction. And I'm not addressing these requirements by jurisdiction necessarily here in Kuwait, but across the GCC, right? So what may be applicable in Kuwait may not be applicable in other parts of the GCC or the world, as we travel, as we share patient information, for consultation purposes and abroad. And I cannot, have this presentation, especially in this conference, without talking about what's at risk when it comes to cybersecurity. This is a very important topic. People have been ignoring, cybersecurity for the longest time because we were not connected. But the moment that we became connected and on the internet, then, all of a sudden, it's been, there's a huge appetite for many of these cyber criminals, as, many of my colleagues have highlighted earlier today and yesterday. But really, what's at risk is hardware, software, networks, medical devices, health information, and people's lives. So one thing is if you lose, all your money in your bank accounts, God forbid, right? But it's another thing when, the information is stolen or hidden, and then the clinician prescribes a medication that has an interaction with another drug, or the patient is allergic to it. And then all of a sudden, this patient, will definitely suffer an adverse event and can potentially die. And this is why, it's paramount that, we pay attention to this. And in a recent report by Deloitte, they've highlighted, why some of these cybersecurity threats have been increasing. I'm not going to spend much time on this because I know many people have covered this already. But one thing that we need to pay attention to is there are many people out there that really want to make money or a fortune out of other people's miseries or their difficult situation. But I think it's very, very important that we have and we consider and we employ the ethical considerations for digital interventions. And this has been published by the World Health Organization. I put the source there for you, and I'm sure I'll be sharing my slides with the organizers for you all so you can get back to these slides. But we need to look at the time limitations, testing and evaluation, limited retention of these records. We need to be notifying people. We need to have accountability. There needs to be an independent oversight. And so I need to say this very clearly and out loud, right? We're in the e-government conference, but we need to have independent oversight. It's one thing that the government does what it does, and we appreciate all the fantastic efforts that have been, done by all our wonderful and great colleagues in the front lines, but there needs to be an independent oversight. There needs to be civil society and public engagement, and it only needs to be happening in a privacy preserving manner. We need to respect that and respect people's anonymity and do everything that we do digitally. It does not mean that because we can do things and we can use artificial intelligence or mobile apps or whatnot, that it's okay to do it. We need to do this in an ethical manner. So, some of the key points that, I'd like to make towards the end of my presentation is we need to also be paying attention to, and, looking beyond COVID, we need to be removing harmful apps from the app stores. There are many harmful apps out there related to healthcare in all facets of health that we need to be paying attention to and actually educating the people about. We need to be using relevant data insights to inform the greater public health interventions. This is key. Without this, we're going to be flying blind, and this is not acceptable. We need to have evidence-based adoption and evaluation of our digital health tools. Again, it does not mean that I'm super excited that I have, my phone, or because I can develop something, that I do it without necessarily evaluating it carefully and critically. We've seen how the vaccine was developed. We need to do the similar approaches to our digital interventions. We need to also leave no one behind, especially those that are most vulnerable. And what do I mean by that? In Kuwait, we have many people that cannot or do not speak Arabic or English. So we need to be paying attention. If we're going to be mandating some apps, some resources, some interventions, that there are other ways where people can access these interventions, but also can access them from their own cultural or demographic perspective. We need to train, enabling the workforce in the healthcare sector, especially, as well as our consumers of healthcare services. We need to transform services and think critically about process reengineering. I'm very happy. I've heard this from the top leaders in the digital space. We've heard it yesterday from Citra. We heard it from Her Excellency, the minister. We're hearing it from the experts. We need to really critically think about process reengineering. Otherwise, all our efforts are going to be futile and not going to be successful. And I'll end with this. Digital tools and interventions are key in fighting the pandemic and beyond the pandemic. And we need to be realizing that this is going to be the new normal, or needs to be the new normal. However, if anybody out there thinks healthcare is easy and it's simple, just as simple as any other domain, you are wrong. Healthcare is complex, and there are many public health crises that are making it more challenging. And again, we need to be preserving and protecting the privacy and security ethically, and that's a key word. I appreciate your time. Thank you so much, and I'm happy to take, if there are any questions or comments, be happy to entertain them. Thank you.
Sure. Thank you so much, Dr. Dari, for joining us live today at the eGov 8 Day 2. We really value your presence. Well, right now, unfortunately, the time is up. And also our next speaker is ready for the session, but we'd really like to thank you for your valuable time. And with your credentials on the screen, I'm sure our eminent speakers and all the ones who are attending would love to connect with you. Thank you so much, Dr. Dari.
Fantastic. Thank you. Thank you for the opportunity, and please stay safe, everybody. Thanks.